Namaste London. Hope you guys are doing well. In this video, we're gonna talk about MfDS examination and about their latest changes is under the loop. So, in today's video, we're gonna talk in detail MfDS exams, current scenarios going on, and their futures or recent changes is going to implement very soon. So, if you are dental surgeons wanted to know or wanted to do about a specialty exam in the future or wanted to postgraduate training in the specialty, you need mandatorily MFDS both part 1 and part 2 exams. And if you are the overseas dental surgeons or the international dental surgeons, what the international dental surgeons they usually do, they give this exam so that they can write MfDS, Royal College of Surgeons, England, Edinburgh, or the Glasgow. So if you are thinking about it, so then this video will be definitely about you. Okay. So as you know, the MfDS has two parts, part 1 and part 2. We will talk in some other videos in detail what exactly the part 1 and the part 2. But in short, part 1 is the multiple choice based question, and the part 2 in which they will assess about your communication, clinical assessment, and the clinical reasoning. These are the three main pillars for the MfDS part 2. Once you clear MfDS part 1, then you are able to get the MfDS part 2. And every means each educational institute has their own fees ranging from, like, for the part 1 is between 550 or 70 to 600, means tentatively 600, and part 2 700 to 900, and depends upon this location where you wanted to give, but generally 700. And if you are the from the same, suppose you gave the MfDS Part 1 from the Royal College of Surgeons England, so they will give you the 10% discount on the MfDS Part 2. So the Part 2 fees for the England one is 700, so they will give you the 70 pound discount, so you have to pay 630. Okay, come to the point. So currently, if you are 12-month experience after once you graduated in your dental surgery, you can give the MfDS Part 1, followed by you have 5 years. Once you clear your part 1 exam, you have 5 years to complete part 2, and this scenario is going to change very soon. What are the changes? So from 2026 or 2027, you need DCT year 2 and 3, means overall 4-year experience, to give the MfDS exam first. Okay, currently you can give 12-month experience, means 1 year experience you can give straight away, or to 2 years total, yes. But now 4 years. Currently 3, MfDS, Royal College of Surgeons England, Edinburgh, and the Glasgow. These are the 3 institutes or the bodies. They are individually offering MfDS exams. But from 2026 or 2027, why I'm saying 6 and 7, let me clear you later. Yeah, they all are joined together and give tricollegiate exams, means all the 3 body must together. In short, I am saying this. Okay, and the only one exam would be there, so that it would be clearer and straightforward steps for you to get access in the specialty exam or wherever you wanted to apply it. Currently each body has own they run their own exam, a little bit similar or little bit variation on that. So some people give MfDS Royal College of Surgeons England, suppose part 1, but they approach Edinburgh for part 2. But now this thing is going to abolish very soon. So for part 1, if you wanted to give, you have two two more option, two more chance to give part 1. And if you already clear your part 1, you have still 3, like March, October, and November, May and November. Yes, these are the 3 still you have. So for MfDS part 1, you have 2026, the last deadline. Okay, 2, 2 more times. And for part 2, you have only 3 options until 2027, mid of the 2027, followed by what you can do. If you didn't clear your exam, then you need to redo the part 1 and part 2. Currently, if you are clear, then it will be considered. So you have very limited, yes, limited option now. And if you wanted to give the new one, you don't want it to give, suppose you clear part 1 and you wanted to give part 2 after 2 years, so you can request to the bodies and they will refund you for the part 1. This is the current scenario. But the whatever the exam is going right now, it is going more higher standards, more harder in in easy language, more harder and more difficult because it's mandatory now, and everyone wanted to do MfDS. Like most of the overseas dentists, they usually prefer to get this kind of exam along with the those wanted to enroll in the specialty exam. It is mandatory now. So once it get mandatory, the lots of peoples or the dental surgeon, they are in the queue for MfDS exam. Yes, so these are the major changes is going to show. Yes, so first of all, you have two chance for MfDS part 1, 3 chance for MfDS part 2 for current scenario, followed by you can give but little bit harder and the higher standards. Currently you can approach to Royal College of Surgeon, England, Edinburgh or Glasgow. Any of the you can give, or you can give both England one, Glasgow one, and the Edinburgh simultaneously, no problem. But later on, only one option. Yes, yes. Secondly, they are making it more harder so that your clinical competency, clinical reasoning, and communication would be higher up to the level of to meet the requirement for the specialty exam. So these are the overall changes is going to implement very soon. So if you are thinking, just don't wait, think about it and do it. Okay? Yes, don't overthink. Go ahead. And if you wanted to know about how you can do the MfDS exam part 1 and part 2, then write in the comment box. I will make the separate video how you can clear the exam part 1 and part 2. And if you have any doubt regarding this, please write in the comment box. I will give you the answer. As you all know that I'm not the solicitor, I'm not the agent. I'm just helping you guys with whatever the experience or the knowledge I have. So do your own research and take the decision accordingly. Okay. Thank you very much. Hope this video will help you at some point. Namaste. Bye bye.